Hi, everyone. In honor of the release of my new book, Nutrition Essentials for Mental Health, I want to share with you a few guidelines for the use of some special nutrients, some of which may be unusual or new for you to learn about. I've been thinking a lot about how my clients are complaining about challenges with sleep a lot, and I wanted to share with you one of my favorite sleep aids called Lactium. Lactium is the generic name, and it really is a concentration of casein that was developed in France as a reflection of the awareness that babies fall asleep after drinking mother's breast milk. And what they've done is they've hydrolyzed casein, concentrated it, and capsuled it in 150 milligram capsules. And I find that Lactium requires maybe anywhere from 300 to 450 milligrams in order to aid sleep. The metaphor that I use is unlike a benzodiazepine medicine or Ambien. It's not hitting you over the head with a hammer. Indeed, it's just lowering the temperature a little bit. It is lowering the sound on a blasting mic that is just too loud, and it just tempers a little bit of anxiety. It tempers any number of ruminations that can be interfering with your sleep. So look into Lactium. It's also called milk biopeptides. If you're sensitive to casein, most people do not experience a reaction to it, but if you're staying off casein because it can trigger depression or psychosis, I've got this next nutrient that I would try. The next nutrient has broad application, and it's the mineral lithium. And if any of you have ever had the opportunity to soak in lithium-rich mineral springs, for example, at Ohanapakash at Mount Tahoma, also known as Mount Rainier, or in the springs of Texas or New Mexico or the Southeast United States, and of course in Mexico itself, you'll notice that when you soak in lithium-rich mineral springs or drink the water, you start to giggle. Your mood elevates. And as we know, lithium, the pharmaceutical, is a long-time, very beneficial treatment for regulating circadian rhythm, which is the underlying imbalance that contributes to bipolar disorder. It lengthens circadian rhythm. However, the high doses of lithium carbonate really can lead to side effects such as kidney damage. And so we're using low dose lithium, which crosses the blood-brain barrier for sleep, for mood stability, and it is shown to be neuroprotective and very potentially neuroprotective of neuronal death and degradation associated with the development of dementia, in particular Alzheimer's type dementia. 5-10 milligrams of lithium nightly will aid your sleep, help you calm down, stabilize mood. And if you're interested to know more about the use of lithium, I cover it in depth, particularly when you're helping someone taper off some of the atypical antipsychotics or mood stabilizers in bipolar disorder. The other nutrient I want to share with you is CoQ10. Now, you may be familiar with CoQ10 because it is one of the most important mitochondrial assists that we make in our body. It's so good for our heart. It's good for our mentation. And it's also good for fibromyalgia. And many of us treat people who have histories of chronic or complex PTSD, complex trauma, who also have fibromyalgia. In fact, I don't think I've ever seen a case of fibromyalgia without a history of chronic stress and trauma. And as you see here, I've got it in a chewable form, and I also have it in a liquid form. And I like to move back and forth between using it myself. a normal dose, a regular dose, let's say you're on a statin, it's absolutely essential because statins decrease CoQ10 in the body and in the heart. So it's very important to be on 100 or 200 milligrams. When you are using it for fibromyalgia, I mix a proteolytic enzyme along with 300 milligrams of CoQ10 daily. And the proteolytic enzyme, which I'll talk about, is nattokinase. Now, there are a number of proteolytic enzymes, and one of my favorite brands, and I don't get any kickback for saying this, I don't earn any funds, but I'm really a real stickler for the highest quality. And Arthur Andrews has the highest quality proteolytic enzymes in my experience. So I'll use nattokinase, which is fibrinolytic. It will scavenge blood clots. It's a blood thinner. So if you're already on a blood thinner, you need to speak with your prescriber. Sometimes it helps you reduce the need for the blood thinner, meaning reduce the dose and therefore reduce your side effects. The nattokinase is also from a fermented traditional food in Japan called natto. And if you get the chance to eat natto, I think it's worth a culinary adventure. So I might use nattokinase along with CoQ10. I might also use bromelain, which you've heard me talk about related to pineapple, or I might use papain as well, because all of these proteolytic enzymes, and you hear in the word proteo, protein, lytic, digesting, breaking down. These break down the proteins of inflammatory process, and that's evident in fibromyalgia. So now you've got a few nutrients you may not have heard about before: Lactium for sleep and anxiety, CoQ10 for energy, for mitochondrial function, nattokinase, proteolytic enzymes for just having a lot of anti-inflammatory process broken down in your body, which in turn is going to be antidepressant and anti-anxiety. You can learn all about these in depth along with dosing in my new book, Nutrition Essentials for Mental Health.